Women supporting women.
Of
Wow.
$2 million. So of that, I went to the Philippines and we focused on medical education and
Welcome back, everybody, for another episode of Everything Koshur. My name is Ritvik, your co-host, and today we're bringing in some another interesting Kashmiri youth who's going to be talking about their life.
Hi, everyone. This is Akansha, your other co-host, and we are delighted to introduce Sandhya Tiku. And we'd love to give her a chance to tell us a little bit about herself and the wonderful and very interesting startup that she's created.
Okay. Namaskar, Sarni. Hi, everyone. I'm Sandhya, a co-founder and CTO of my medical device startup called SinuStim. So I started SinuStim out of my master's program here at Hopkins. We did what's called an innovation and design focused master's, where they lead you through the biodesign process of finding an unmet need in the clinical sphere here at Hopkins Hospital. And then we build a solution, build a business model, and see how the product can be launched in the real world and actually sell. So I did that, graduated in 2024, and had a lot of success in our animal studies. So we launched as uh, a small startup in May 2024, and I've been leading the technical division and as a startup, as most people do, the business side as well, despite being the CTO. So,
Yeah, the startups come with multiple hats, always super interesting. You get to experience a lot of stuff.
yeah.
And thank you for that intro. And I guess before I'm super interested in learning about the startup and how you came up with the idea. But I guess before we get into that part of it, just understanding a bit about your foundations. You did a biomedical engineering degree, right? And was that always something that you wanted to get into, or like many other Kashmiri youth that I have met, were you pre-med and then switched to biomedical engineering?
Well, um, to my parents' dismay, I did not do pre-med despite how much they wanted me to. And I actually, well, so I grew up in the Bay Area in Silicon Valley in Cupertino, a mile away from Apple headquarters, and so AI and computer science were shoved down my throat from like middle school. Like kids were coding in middle school type of thing. So, from
Ground
my
zero
personal
for AI, yeah,
yeah.
basically.
Yeah. So from my personal experience, I was like, I want to work with people and I like healing and um I love doctors and what they do, but then I was like coding from high school. And I was like, this is really both things are really cool. I want to see how I can combine them basically. And I did in high school a program where I went to the Philippines and we focused on medical education and dispersing medical care in the Philippines. And so, and I loved it. And I loved the global health element as well. So I went through biomedical engineering into UT Austin. So then I moved from my AI focused Silicon Valley area into the howdy y'alls of Austin, Texas, doing biomedical engineering there.
Did you like Austin?
I loved Austin. I loved Austin. The first thing my parents did when I decided UT Austin was reach out to the KOA rep there,
Of
the
course.
KOA
That's
zone
so
rep,
precious.
and was like, who do you guys know in Austin that can watch over my daughter? She's leaving home for the first time. Shout out Pamposh uncle and Anjali auntie for taking me in when I was just a little kid coming to college for the first time. And then so many other Kashmiris that we met there.
That's so sweet.
Yeah.
The KOA network is all over the place, and I bet it's really strong in Texas, right?
Yeah, and even better, they were like, "Oh, you should reach out to this person." And then my parents like, "Oh my God, we know you from this many decades ago. We had this connection that they're just now finding out after the KOA zone rep connected them." So, yeah. Yeah, that did happen.
That's so sweet. I love that.
You always find Kashmiris like anywhere, and all of them are always doing something interesting. It's crazy.
Yeah.
The network in the US especially has been pretty nuts.
And as a startup founder, I am guilty of abusing that network. It is
As you should.
Oh, I'm so curious to hear about
yeah,
that. So one of the things that I really like learning about from startup founders is I'd love to hear your elevator pitch, or if if it's like trade secrets and you don't want to talk about
yeah,
it, that's fine. But like a very condensed version of what you tell investors what you do. And I would love to hear like what you're telling Kashmiri investors or Kashmiri people in your network to kind of help you get to where you're going.
yeah, yeah. So, my startup's name is SinuStim, and what we're building at SinuStim is a neuromodulation technology. Basically, you think of it as a mouth guard or a retainer that you put on that has two electrodes that stimulate the palate. And with our stimulation parameters, we cause the nose to just instantly open up. So anyone who has chronic rhinitis, chronic nasal congestion, or any sinonasal disease symptoms, you put in this mouth guard, turn it on, and within 5 minutes, your nose clears up. There's no congestion, there's no drippy nose. Maybe if you have some facial pressure from your mucuses being filled, your sinuses being filled with mucus, that gets cleared up instantly. And we ran our first in human trial last year in 30 patients and stimulated them for 5 minutes and found that it gave an average of 8 to 12 hours of relief in patients across all these symptoms. So we are going through the FDA because it is a regulated medical device and will launch and sell the product first in 2028. So we have quite the road, but we're in the middle of our fundraising round right now, raising to complete our device design freeze and our second human study. And my God, the medical world, the med tech world, the amount you have to pay consultants in the regulatory and reimbursement space, you have to pay out of,
There's a lot of red tape, yeah.
Oh, there's
yeah.
so much red tape, especially because you're putting this in people's mouths like that.
hmm
I can only imagine the amount of like very fine line work that's needed to do to make sure that it meets the parameters necessary to
Yeah.
become FDA approved.
Yeah.
So
Yeah.
you mentioned that this was born out of your master's program
hmm
and it's being used to fill a need in areas of health or medical technology that have not been filled. And so what made you want to focus on like ENT or I probably have that wrong on like the
No, no.
nose, the sinuses, things like that?
But that's not really like Sinitis
That's
isn't really
niche.
something that comes out.
Yeah.
It's not
Yeah.
the first thing that you think about when it comes to healthcare issues, right?
Yeah.
Yeah, I won't take credit for choosing the niche because the way our program works is they put us into teams of students and connect us with physicians at Hopkins Hospital that have basically volunteered to support innovation in their department. And so we were given the Department of ENT, and I had a teammate in my team who was doing his ENT residency in Vancouver at the University of British Columbia, and he took a year off his residency to do this program. And so we had a resident expert in our team that was working with us, and obviously had interfaced with a lot of patients and knew the area really well. So, um, with his insight plus the insight of our clinical advisor, we shadowed for like, I think collectively several thousand hours in the OR and his clinic to see what can we actually work on and build a medical device for that can truly help patients that need it and is not what some people call a me too product of an incremental improvement in what already exists. And we found that the space is quite crowded with a lot of medications and you know how American healthcare is. There's a massive push for pharmaceuticals everywhere.
Yeah,
And we
there's never a
realized,
fix, but you could take a pill for it to make it better every day.
It's a
yeah.
subscription model,
Yeah,
basically.
it's a subscription model. I have terrible allergies, horrible, horrible
hmm
seasonal allergies, and
hmm
have rotated between Zyrtec and Allegra my entire life.
Not
No one will fix me, but they'll sell me their pills.
not to sell you my device, Akanksha, though. You may be a perfect fit for what we're building.
You were talking about this and you're like, it'll
Yeah.
clear your sinuses and you'll be able to breathe. And I'm sitting here like unable to breathe right now. And I'm like, when
Yeah.
when'd you say 2028?
2028, yes. But we're recruiting for our clinical study, so if you're ever in Baltimore, let me know.
I might be in Baltimore. How about you let me know? Because I need sinal relief. I have since I was a child.
Yeah. Yeah. So exactly. I mean, exactly. So you're a very typical patient where they're like, especially maybe you primarily have nasal congestion, but if you get runny nose plus post-nasal drip plus some facial pressures from your sinuses being filled with mucus, you take a cocktail of medications. And these poor
Yes.
patients are like, we don't want to do that. There's a risk of glaucoma, cataract, etc. And then their other option is surgery. And there are many people that are like, either we can't afford that, we don't want that, we don't want, to go under general anesthesia. So we were like, what can we build for the average human that's like us that unfortunately has seasonal allergies or just like really bad nasal congestion and
Please,
needs a
I want to support a Kashmiri youth entrepreneur, and I also want relief so badly because all of the things you're saying, post-nasal drip, runny nose, stuffiness in your face, that's why I'm sick today.
Yes. Yeah.
Offering your body to science, like test, you can test on me whenever you
Yeah. Yeah.
Yeah, no, I'll send me the form. I'll sign it.
No, we'd love to have you. We'd actually love to have you.
No, that would be amazing. I need the what my doctor had told me a long time ago was my best case scenario is I do allergy shots, which is like a 10 to 15 year commitment and they can't even guarantee it works.
Yeah.
Oh,
The medicine is like a band-aid.
Yeah. Yeah.
But
So,
that's super cool. That's a very interesting niche that I am genuinely very interested in keeping up with now. I'm gonna set a
yeah.
Google alert now.
Yeah.
Um,
Yeah.
you're
but so
getting
you
to
mentioned
follow
that
him on
you
LinkedIn and
Yeah,
feed.
I'll follow you on LinkedIn. I'll keep an eye out on your company. I'll look
Yeah.
for we're
Yeah.
looking for more human candidates. I'll show up at your door.
Yeah, yeah, yeah. Well, we just got I just posted on our company LinkedIn about how we were chosen for um top Maryland startups according to this company called Technically. So, we're
Oh,
exciting. We're making some
congratulations.
progress, gotten some funding, and so
What
um
round of funding are you in right now, if you don't mind me asking?
yeah, so we raised some non-dilutive funding in our pre-seed round. So we basically traveled across the US going to any pitch competition that would take us, won a bunch of competitions, won some grants from the NSF, some grant here local to Maryland called TEDCO. And now, that money got us through all the milestones we've completed, and now we're raising a seed round of
Wow.
$2 million. So of that, we've closed around 650K.
Nice.
That's very
Wow.
cool. I'm an attorney and one of my previous jobs I worked at an immigration firm and I did startup founder visas. So I did a lot of O1 and EB1s. So I worked
Mm.
with a lot of startup founders and all of them were like Y Combinator founders. So
Yeah.
is that something that is that kind of an avenue that you are looking into pursuing or is that I'm always
Yeah.
so curious about that.
Yeah, so YC is something we looked at, but as every single person in the San Francisco Bay Area loves, we're not an AI company. And
Yeah.
so it isn't their ideal company that they would take on because we have, they hate regulation and going through the FDA and medical
Mm.
device startups are a whole other ball game of what you're
I bet.
building with clinical studies and FDA. And so,
I bet
we're
there's
not.
better incubators out there for that
Oh yeah.
too.
Oh yeah,
Is
there's
that why
one.
you're still in Maryland? The better incubators closer connect to Johns Hopkins hospitals.
Yeah, we've done a bunch of incubators here at Hopkins.
Mm.
And the really ripe ecosystem for medical devices is Boston and a little bit of San Diego in the biotech space, but we have our eyes set on a uh, incubator in the Bay Area, just because that would be home for me. Called Fogarty Innovation, which partners with Stanford medical device companies. And so
That's
that
awesome.
that would be my ideal place to be with the beautiful California weather and like Rogan Josh a 10-minute drive away from my mom's place and then also work on my company. Yeah.
Sounds
That
like a triple
is,
win. That's part
yeah,
of the reason
the
I moved
ideal
to
place.
Chicago.
Yeah. Yeah.
how did you go from, thinking about, okay, we're going to be working in this space to actually like building out a product that could address the problem that you guys found?
So, um, the way the master's program works is they partner. Okay, so actually, this master program is kind of crazy because what you do is that you actually work on two projects the whole year, which is why I did this specific program. You do your shadowing in the early summer, June, July, when you first join it. You do shadowing at the Hopkins Hospital. You come up with like a list of 1,000 needs in that department of innovations you can build. And then you use a filtering process based off of the clinical, business, and technical feasibility of those ideas to determine what's a really strong need. And then you take a break from that. And then you work on your second project, which is in the global health space. So then in August, I traveled to India and we partnered with a company called IntelliHealth that is working on telemedicine in rural India. And so we did some needs finding there and tried to understand how telemedicine in India works and where are the gaps in care there. And then during the whole year, you're building on both of these projects at the same time. So, for 1 hour, I'm writing out code for integrating large language models into a telemedicine platform. And the next hour, I was looking up designs and ways to stimulate nerves and how, which parameters are the ones that would create this therapeutic effect in patients of decreasing nasal congestion and other
So like
symptoms
the
as well.
largest chunk of your time was probably spent just like meeting with people and like
Oh,
different like hospitals, like just to understand, okay, what are the biggest issues? Just like a lot of gap finding, niche finding, and then
yeah.
simultaneously you're also working on code and the tech side of things to see, okay, what makes most sense to integrate, how.
Yeah, yeah, yeah. Like they emphasize that the value in innovation is not just making something that's cool and new, but it's making something that's cool and new and can be used and is needed by the people.
Mhm.
Um, so we did a lot of customer discovery, and that was the focus of like basically our first whole semester in the program on the start. Yeah.
And so
And
did
then
you hear a lot of like very similar experiences that I had just shared of like it's all a Band-Aid solution. I have to go between multiple meds all the time and it still doesn't really fix it. I end up having to take a
Mhm.
Benadryl at the end of the day sometimes, and that, throws off the rest of my day.
Oh yeah. Oh yeah. And if there's a lot of literature as well about how many work days people end up missing because of this disease, just because like some days you're like my sinus infection is so acutely severe. I can't focus or do any work today. We had a person in our program who took so many days off school just because like when their sinuses were super inflamed and they had really bad symptoms. They just couldn't focus, and the fatigue was insane. So, yeah,
It's very real.
again
My
and
my
again. Sorry, yeah.
No, my most embarrassing moment in my entire life was I had an allergy attack in the middle of a chemistry test in college
Hmm.
in a weed out class. There were 300 people there, and I sneezed like someone's old dad. So I'm like screaming and sneezing and then trying to go and control myself and coming back, and it doesn't stop. They ended up actually asking me to leave. They were like, "We'll give you another room, but you are disrupting the entire class." And
Oh
I don't think
no.
I've ever been able to live that down internally.
Oh
Yeah, your device would have been very helpful in 2017 when I was suffering.
no. I mean,
Same.
it's really funny now in hindsight, but that
Yes.
also sounds like it would suck. Oh my God.
In the moment, you were probably like, "Oh my God, why now?
I was
Why?"
Why
mortified.
now?
I was like, if I just drop dead right now, I think everyone would be a little bit happier because at least I'd stop sneezing. At least I'd stop sneezing.
Oh God. Yeah, you poor thing. It's hard. I know. It's
It's
really
hard.
tough. It's a way um under the severity of this disease is very undervalued because they're like, it's just a stuffy nose, who cares? But it actually is like so debilitating.
My quality of life is bad during the spring because everything's actively trying to kill me.
Yeah, literally.
Yeah.
I
But
know.
So we've only got a little bit of time left, but I would love to use that to learn how you utilize your Kashmiri network to kind of help with building out your company and finding new investors or well, actually, I don't even know if that's how you use your network. I just love to learn how you
Yeah.
use it.
Well, I'll tell you, my parents play a massive role in this. Like they love talking about, oh, my daughter's working on science and blah blah blah. Yeah, yeah, they were at the um
Your dad mentioned it in the first class of Kosher Hitcho, by the
yeah,
way.
That's so
of course.
sweet.
Yeah. No, they were at the Zone 9 Shivratri, the Harith function. And they were talking they met some guy who was an investment banker. And they told him about it. And he has connections in the VC space. And so my parents were like, "Oh, we got his email. Like you should reach out. Go talk, And you don't know who he knows. So it's something like that. Or it's also like there is a KOA medical director, and there's some people working on building that program out in KOA. And so, um, uh, when I was doing a huge amount of customer discovery and doctors, I could reach out to them, and they connected me with people that were in the ENT space. There's a Kashmiri ENT that I spoke to, and he was super helpful. I met him at a conference multiple times. So it's like in every area when I'm like at my wits end with who can I go to for, finding someone in this area. Um, my parents have someone that knows someone that is someone's brother or sister or brother-in-law that has some sort of relation to it. So it's incredible.
Fantastic leverage of network. That
Yeah.
is exactly how it's meant to be used.
And everyone is always so open to talking to me and like been very kind. Got some people that were like, "Oh, we want to support Kashmiri youth, and we'd like to consider seeing if there's a way we could invest." So it's been so just awesome seeing how supportive everyone is.
Have you, working in this space as a very young founder, and as also as a woman, have you felt that there are certain like obstacles that you faced, or like you've had to walk into a room and like actively had to prove yourself? Has that been like a common situation?
I'll tell you early on, one thing that really got me, um, is that my co-founders are both male. Um, we were connected to somebody else from someone we met, and they copied us both, and that person responded and thought I was the assistant, and I was like, oh no. That got me for a couple days. I was down bad. I was like, what
That
am I doing? I was like, what am I doing that I am thought to be the freaking assistant?
Yeah,
Yeah. And
you're
he didn't have any context, to be fair. Like this poor guy, like just was connected, but he just assumed that the one woman that was tagged on the email was the assistant. Anyways, I have since moved on and realized that I don't need to feel bad by these things. Like I had during my master's year, I was very, very sensitive to it, that my professors made more eye contact with my co-founders, and like people, investors that we talk to, they just positioned themselves in a way, or like I'm shorter than my male co-founders, and so we're standing and talking, and they're just looking at them, and once in a while they'll like bend their neck down to look at me, and I was like, I'll just kill myself here, I guess. Can't see me because I'm too short or because I'm a woman. I don't know what it is, but eventually I just realized that if the more I think about that and be obsessed with that fact, the more that actually pulls me down. And um the less I thought about it, and the more that I was like, you know, I'll just talk as I normally would, and don't think about what others are doing. Um, that it was received much better, because like when you try to prove yourself, people are like, oh, she's working really hard to prove herself. There's something that's going on, as opposed to when I just was like, no, I know who I am, and my work speaks for itself. I don't need to fight for attention or anything. And when I just had that mentality shift, I wasn't bothered by it anymore, and then I stopped noticing it, and I just focused on doing whatever I do best, which is talking about my startup.
That's amazing. And it's hard being a woman in a male dominated field because it feels almost like you're being talked down to at every step. Even though you have absolutely earned your spot in that room, you've earned your spot at that school, you got the degree fair and square, you passed all the tests, you did everything you needed to. You are as capable as anyone else in that room, and you have nothing left to prove. Your work speaks for itself at the end of the day. And if someone has an outdated sexist and misogynistic view on you and your value and your input, that's their problem because,
Yeah, it's not a reflection on me. Like the women's
exactly.
hockey team, they said it
Yeah,
so well in that press conference. She was like, "Why are you asking me? This isn't my problem. Like, I want to just celebrate my wins." And like that's what I've realized is the actual is what women need to do. It's like this, it's not for me to talk about what other people are doing to disrespect me. I just need to focus on what I'm doing, and my worth will come.
exactly. Your work
And there's so many
for itself.
women
Yeah.
that are doing such cool things, um and they're so supportive of other women.
Women supporting women, it is the only
Yep.
way that we get through this.
Yep.
No, those were that's a great story just talking about like, what's wrong in the R&D space and like even in startup space. One final question for you. What do you think success means to you like right now? And yeah, what does success mean to you right now?
In my life or in my startup?
Both, I guess.
Both.
Yeah.
um Interesting. This is a conversation that I've had with many of my friends. But being a startup founder, be like, what is success to you, in your personal life? Whether that means going all in on your startup and just being hyper focused on that, putting everything into that as you take that on as kind of your child, versus being really strong at balancing everything. And that's kind of what I've found to be my definition of success. If I'm able to balance all aspect, social, my mental, my physical, and then my work life or my intelligence aspect of my life. If I can balance all those and maintain true to myself and my values while I work on something that I love working on, that's success there. In my startup, success is moving forward. Like, obviously, I want to close this round and I want to complete my second human study. But if I move forward and if I make progress and every small step that we need to, my startup's a success.
Well, that's amazing. Thank you so much for sitting down with us.
No, thank you guys.
This was a great, great conversation. Thank you so much, Sandhya.
Thanks for, thanks for
Have a
having me,
great
guys.
rest of your night.
Thank you. You guys too.